Hello to everyone. My name is Luis Montalvo and I'm a med student at Universidad Católica de Santiago de Guayaquil. Today I'm going to talk about bipolar disorder. So here's my personal info. Here are my Facebook, Twitter, and YouTube accounts so you can follow me and watch the other videos I uploaded. I hope you really like them. So first, what is the definition of bipolar disorder? It was formerly called maniac depressive illness or maniac depression and is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day to day tasks. Applications in medicine. There are three types of bipolar disorder: bipolar 1 disorder, bipolar 2 disorder, and cyclotimic disorder. All three involve maniac and depressive episodes, and maniac episodes are characterized by overconfidence, grandiosity, talkativeness, extreme inhibition, irritability, decreased need for sleep, and highly elevated mood. There are also psychotic symptoms in maniac episodes. These psychotic symptoms are hallucinations and delusions, and they occur in about 75% of maniac episodes. Bipolar 1 disorder. It is defined by the presence of overt maniac episodes with the previously mentioned manifestations: overconfidence, grandiosity, extreme talkativeness, extreme inhibition, sexual impairment, and the psychotic symptoms, which are hallucinations and delusion. These have to these need to have a duration of at least 1 week to for the diagnosis to be made. And episodes can compromise psychosocial functioning to the point that hospitalization is required. Depressive episodes also occur and they last for about 2 weeks.
I'm Dr. Ben Michaelis, and this is 1 Minute Diagnosis. Today I will be talking about bipolar 1 disorder. Bipolar 1 disorder is different from depression in that there is at least some form of mania present, which is why in order to make a diagnosis of bipolar 1 disorder, you first need to identify a manic episode. A manic episode is a period of elevated, expansive, or irritable mood, goal-directed activity, or energy lasting for at least 1 week. During this period, you need to see at least 3 of the following 7 behaviors: inflated self-esteem or grandiosity, a decreased need for sleep, an increase in talkativeness, racing thoughts, distractibility, an increase in goal-directed activity either socially, at work, or sexually, and excessive involvement in activities with potentially painful consequences like spending, drugs, alcohol, sex, foolish business investments. This period must be severe enough to cause an impairment in social or work functioning or require hospitalization. And that's bipolar 1 disorder in a minute. For other diagnoses, please visit drbenmichaelis.com.
Now, here's a video of a lady which speaks about what a maniac episode feels like. So I hope you like this one too.
Hi, I'm Christine Anderson, author of Forever Different and CEO at Christine F. Anderson Publishing and Media. I am also bipolar, and I'm here today to answer the question what it is like to have a manic episode or what it feels like to have mania. And this is kind of one of those loaded questions because everybody's mania is so different. So I'm going to describe what my manic episode is like, and maybe it touches upon some of what you out there watching have gone through. So for me, it usually starts off with something situational. Something has to spark that adrenaline rush, I call it, or the need for speed, if you will. It's kind of like a description of a street drug high, but 10 times the effect of a street drug. I mean, no street drug can compete with a manic high. which is why it's so addicting to some people who prefer to be in manic episode than depressed episode. But for me, it may be like this year for me, the holidays triggered a manic episode. And I went on a buying spree. And everybody and anybody I know got Christmas gifts. And so risky behaviors. Sometimes in my earlier years, in my youth, sexual promiscuity. I was famous for going into a bar and, meeting a guy and not asking any questions and going home with them and and calling it a night. So sexual promiscuity is an issue in mania. Criminal activity is an issue in mania, which was for me. Doing things that are high risk, doing things that are detrimental to you, maybe even harmful and hurtful. And the fallout is great. And the aftermath is what I like to call the aftermath of the hurricane. The hurricane has now hit, and now how do I clean this up? And that really is what is most terrifying for a bipolar person coming out of a manic episode. What did I do? What did I create? And now, how do I fix it? Who did I hurt? And how do I make it up to them? And so I'm here to tell you, you're not alone. We all go through it. And the best thing that you can do is try to learn when you're in mania and catch yourself and go to your doctor and get some help, or call a prevention hotline if you need to, and get some guidance and get somebody maybe to help you talk you down through it and ride it out as best as you can with as little collateral damage as possible.
So now, bipolar 2 disorder. Bipolar 2 disorder is characterized mainly by episodes of depression, but alternating with hypomania rather than mania. Now, what is hypomania? Hypomania is a less severe form of mania, and the main difference between both is that in hypomania there are no psychotic symptoms, so there are no hallucinations, no delusions, and the psychosocial functioning is not compromised. So there is even an increase in energy in these people, and this might help them to improve their skills and functioning. Now, here's another video about bipolar 2 disorder.
I'm Dr. Ben Michaelis, and this is 1 Minute Diagnosis. Today I'll be talking about bipolar 2 disorder. Bipolar 2 disorder is less severe than bipolar 1 disorder because there's no full-blown manic episode. To make a diagnosis of bipolar 2 disorder, you need to see a hypomanic episode, which is similar but less severe than a manic episode, and a major depressive episode, which we covered when we discussed major depressive disorder. Hypomanic episodes are periods of elevated, expansive, or irritable moods, increased energy, or goal-directed activity, lasting for at least 4 days. During this period, you need to see at least 3 of the following 7 behaviors: inflated self-esteem or grandiosity, a decrease in the need for sleep, an increase in talkativeness, racing thoughts, distractibility, an increase in goal-directed activity, either socially, at work, or sexually, and excessive involvement in activities with potentially painful consequences, like spending money, drugs, alcohol, sex, or foolish business investments. These behaviors must be different from the way the person usually acts, but are not severe enough to interfere with the person's social or work functioning. And that's bipolar 2 disorder in less than a minute. For other diagnoses, please visit drbenmichaelis.com.
Now, cyclotimic disorder. It is defined by periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years when you're in children and adolescents. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. Pros and cons. Manic episodes may increase performance in people with hypomania. That is the only pro. And this is in bipolar 2 disorder. Now, the cons in all of these disorders, mainly in bipolar 1 disorder, is that it causes cognitive and psychosocial dysfunction, achievement of developmental milestones is affected, 6 to 7% of people with this disorder commit suicide. There are high rates of coexisting psychiatric conditions such as anxiety, substance abuse, personality disorders, and attention deficit hyperactivity disorder. And there is a higher prevalence of chronic medical conditions such as metabolic syndrome, migraine, obesity, and type 2 diabetes mellitus. Issue applied in Ecuador. The global prevalence of bipolar 1 disorder is 0.4 to 1.6%. Bipolar 2 disorder is 0.5% of global population, and cyclotimic disorder is 0.4 to 1% of global population. Now, in Ecuador, in 2016, the 17.3% of psychiatric patients attended by the MSP had mood disorders. The bipolar disease is included here in mood disorders. Now here's another video.
El trastorno bipolar es una enfermedad de los mecanismos que regulan el estado de ánimo, que están localizados en el cerebro. Así como en la hipertensión, por ejemplo, las personas pueden tener altos y bajos de presión arterial, también nos puede ocurrir esto con nuestro estado de ánimo, nuestra energía, nuestra capacidad de dormir, etc. El trastorno bipolar tiene 3 tipos. El tradicional o el más conocido, el más grave, es el trastorno bipolar tipo 1, antiguamente llamado psicosis maníaco-depresiva, que es una forma en la que hay periodos de euforia muy extrema, hiperactividad y depresión grave. Muchas veces estos pacientes necesitan ingresos en el hospital. Luego hay una forma menos grave, que es el trastorno bipolar tipo 2, en el cual puede haber depresiones igual de intensas que en el bipolar 1, pero las subidas, las euforias, son más moderadas, se llaman hipomanías. Y luego hay el tercero, que es el más supuestamente leve, que es la ciclotimia. La ciclotimia es un trastorno en el que hay una inestabilidad muy alta del estado de ánimo, pero con poca intensidad. Entonces son personas como a veces se dice lunáticas o muy variables, inestables, que cambian mucho de humor y que tienen días buenos y malos.
And conclusion. Bipolar disorder affects a significant percentage of people around the world, so an early diagnosis and treatment is very important. Here's a final video, and thank you very much for paying attention. Hope you liked the presentation.
Very high and very low. The mood swings caused by bipolar disorder can range from one extreme to the other.
Moods are kind of a natural experience that we all have, and bipolar disorder is something outside of that. It's more extreme experiences.
Psychiatrist Dr. Daryl Tansky says bipolar disorder is classified as a mood disorder.
The illness usually starts to manifest itself in the late teens to young adulthood years. Genders are equally affected.
But the cause is unknown. Health experts say bipolar disorder is a brain illness where 60 to 80% of people diagnosed have a family history of it.
It's a challenging diagnosis, first and foremost, because we don't have a laboratory study or an X-ray that we can rely on.
The condition will often present with depression. When diagnosing a patient, health experts will often look at the patient's sleep habits, excessive elevated moods, and risk-taking behaviors. All can lead to a positive diagnosis.
Once it's established itself as a chronic condition, the assumed likelihood of recurrence without treatment probably approaches 90%.
Treatment consists of prescription medication along with counseling to help the patient manage their stress, diet, sleep, and exercise.
The